coming to you from what is Native American Ohlone land, what's known as San Francisco, California, which is where I live and where I'm based. And I'm really honored to be able to be here with all of you today at such short notice. It looks like just such a fabulous conference, and I want to thank the organizers for doing such a great job. And I wish I could have been there in person with you. And I just heard a little bit about the COVID alert, but just the fact that you're able to do an in-person conference is just an amazing thing. I haven't been able to attend one of those in quite some time. And Reese, thank you so much for your presentation. It made me think a lot. And I guess what I'm going to talk about today is maybe one way to see it is sort of a small part within the vision of decarbonization for decolonization that Reese is talking about. So I like to think of my work as big picture work and the work that we do at Healthcare Without Harm, but in the context of what we just heard, it's just a little bit. So I am going to share some slides with you all. Give me a second here. That should be coming up. Let's see. Can you all, I'm assuming everybody can see the screen. I'm going to go to full screen here.
Yeah, we can.
All right. So that should be, you should be able to see that. So I saw that the title of this session is Reimagining. And so I want to talk a little bit about reimagining healthcare in the age of climate crisis and how we can achieve zero emissions with climate resilience, climate justice, and health equity. You guys have been talking about this for 2 days, so everybody is, and many of you do this work full time. So you all know and understand what the WHO and the Lancet have both said, that climate change is the biggest global health threat of the 21st century. And I'm sure you are well aware of all the many different manifestations of the climate crisis on human health, and really the potential for the climate crisis as it accelerates to undermine our ability to deliver health and healthcare on a warming planet. So you can see this slide that Carol from CAHA shared with me today, which I think is a really important slide, that many of our health systems are extremely vulnerable to the worsening impacts of climate change. And as the crisis deepens, we may see the collapse of health systems in many parts of the world. And in many ways, the COVID crisis for most of the world was a harbinger of that. The health systems were severely stressed during COVID, and we're going to see a deeper stress from the climate crisis. The other side of the coin, of course, and this is where what I want to talk a lot about today, is that healthcare contributes to that crisis. There have been several studies of different national health systems' carbon footprint. Many of you work on reducing the footprint in your own hospitals or health facilities. We did a study in 2019. That was the first global study ever to be conducted, and we found that healthcare contributed 4.4% of net global emissions. That means if healthcare globally were a country, it would be the 5th largest climate emitter on the planet. So we all have a responsibility as the health sector to work toward decarbonization of our hospitals and health systems. And I think, I want to start, I'm going to come back to some of this, but there's a lot of good news as well. Last year in the middle of the pandemic, the England's National Health Service announced a commitment to delivering net zero national health service by 2047. So that's the largest health system in the world making a commitment to zero emissions. We're also seeing hospitals and health systems in the United States making similar commitments. We've seen the government of Argentina, including in its nationally determined contribution, a commitment to measure its emissions and reduce them. We're seeing hospitals and health centers and state governments in many developing countries move toward low carbon strategies as resilience strategies that are anchored in community resilience and in being able to deliver health, empower health through low carbon strategies in places where there isn't access to health because there's a lack of electricity. So all of that, there's a lot of momentum there's a lot of movement around the world. A lot of the work that's happening in New Zealand right now is cutting edge work as well. And it looked like, again, some of those panels that you've had in the last couple of days underline some of that great work and the potential of it. And at the same time, we are in a situation where the climate crisis is accelerating. We are seeing the beginnings of the impact of what it may look like if we surpass 1.5 degrees. The pandemic has shown us what a multidimensional crisis on a planetary scale might look like, or does look like. It's given us a glimpse of that. It's given us a glimpse of a future of a world deeper in climate crisis. And it's also showed us how response to and recovery from the pandemic provides an opportunity for us to take preventative and preparedness measures that promote greater equity and address the root causes of the crisis. So prevention and preparedness, two fundamental healthcare principles, are also principles that we should be applying to climate change as the health sector. And really, what we need to talk about here is deep systems change. As Reese put it, decolonization is decarbonization. And as part of that, a deep change in how health is delivered and how healthcare is thought of in the world and how we manage that. And so that's a little bit what I want to talk to you about today. And so one of the things that we found when we did that report in 2019 that looked at healthcare's climate footprint was one of our recommendations was that we need to align healthcare with the ambition of the Paris Agreement to get to 1.5 degrees and to protect public health from climate change while building greater resilience and health equity at the same time. And so out of that recommendation, we set to work on beginning to determine how can we begin to reinvent healthcare so it aligns with the Paris Agreement. And what we came up with and what we just released a couple of months ago is the Global Roadmap for Healthcare Decarbonization, which is a navigational tool for achieving zero emissions with climate resilience and health equity. It is the first ever attempt to chart a course to zero emissions for the health sector. It is intended as that navigational tool, and it is a collaboration with the global consulting firm ARIC, who did all of the technical modeling and projections and merged global health and climate data to come up with some pathways that I'll talk about in a minute forward. Its development was also guided by a prestigious advisory group of health and climate leaders from around the world. It identifies how healthcare decarbonization, resilience, and pandemic preparedness can be mutually reinforcing and synergistic. It projects trends into the future and identifies key pathways forward. Its main message is threefold. First, the health sector needs to exert its leadership to take on the climate crisis, which presents a series of health threats that together could make the current pandemic pale in comparison. Second, healthcare can and must chart a course to zero emissions in an unequal world, where some hospitals and health systems are huge climate polluters, and others don't have access to electricity, and many people don't have access to care at all. Healthcare decarbonization must contribute to achieving both greater health equity and climate justice. And third, healthcare must transform itself, and in doing so, contribute to that broader societal transformation that we're talking about here, toward greater equity and greater justice in the world. So, the roadmap also includes country fact sheets with data for 68 nations. And it's a little bit complicated. You can see here's a fact sheet from Australia and a fact sheet from New Zealand. The data is different that we got for each of them. We're using two different databases in order to come up with these fact sheets. The main database did not include New Zealand, but we were able to use another one to get 25 other countries, including New Zealand, in there. So you can't compare it directly, but you'll see that Australia is a much bigger climate polluter than New Zealand is. But you guys also still have a role to play in moving in addressing these issues. You can find all of this on a dynamic online report, healthcareclimateaction.org, where you'll find the fact sheets, the roadmap, and a series of different annexes, a technical report that explains how we did it all, and more. So I want to talk to you a little bit about how we're thinking about reinventing healthcare. So that little dot on this chart is the healthcare's 4.4% of global emissions, right? That's 2 gigatons of greenhouse gas emissions. And what we found as we did this roadmap and as we modeled it is that if we continue with business as usual, healthcare's carbon footprint globally will triple by 2050. Triple. Now, the good news is that if countries were to basically comply with the commitments that they've made under the Paris Agreement, we could reduce that growth by 70%. Yet at the same, and that's not a given, right? We know that a lot of countries have not achieved their commitments and are not on track to achieve the commitments that they've made. But still, even if they did that, healthcare's carbon footprint would increase by 50%. So that's from this line here to right there. So what we did is we modeled a set of different pathways and high impact actions that the health sector could take to significantly reduce its carbon footprint. And this is about how healthcare can begin to reinvent itself. But still, there's still a gap. And this gap we're calling uncharted territory. And in the uncharted territory are tremendous opportunities for us to rethink again how health is delivered and how we protect people's health and have healthy people on a healthy planet. So that's one of the findings, is that there needs to be this sort of set of actions in order to get healthcare aligned with the ambition of the Paris Agreement. Secondly, we also found that fossil fuel combustion is the dominant source of healthcare emissions, 84%. So whether that is coming from healthcare energy use, whether it's coming from the use of plastics, the production and packaging and transport of pharmaceuticals, across healthcare operations, the supply chain and the broader economy, fossil fuels are the main culprit in terms of healthcare's emissions. And therefore, to decarbonize healthcare, the world needs to move toward clean, renewable energy. And the sector needs to do that as well. So how do we get to zero emissions with justice and equity? I think the first thing to say is everybody has a part to play, from health professionals who are prescribing medicines and making daily choices about the products that they use, to engineers making the best use of renewable energy efficient technology, to health decision makers who can put policies and financing in place, to medical students, to all of us, including patients and people concerned with sustainability and health. We need to make sure that our voice is heard and that health is, that climate is defined as a health issue. And one of the other things that we need to do to chart a course is that we need to recognize that decarbonization is occurring in a very, very unequal world. That is the result of colonialism, as Riaz was talking about. So the tremendous disparities in wealth between nations and within nations need to be addressed as we move toward healthcare decarbonization. So we identified 4 different trajectories for different health systems. The wealthiest health systems and the wealthiest countries by GDP need to act most quickly and take the most significant action to get to zero. And the middle-income countries, some middle-income countries may need to actually increase emissions for a few years as they develop in order to provide health for their people, while at the same time putting in place policies and strategies to move toward decarbonization, again, with health equity. But the bottom line is, while there are different trajectories, if healthcare is going to align with the Paris Agreement and do its part to reduce its own emissions, all countries must be closing in on zero emissions by 2050. So, as I mentioned, that blue wedge is complying with the Paris Agreement commitments that countries have made. And this purple wedge is where those 3 pathways and 7 actions are, and they sit. And so what we've identified are these interrelated pathways and actions. So the three pathways are decarbonizing healthcare delivery, facilities, and operations, one. Two is to decarbonize healthcare supply chain. And three is to accelerate decarbonization in the wider economy and society. And then overlaid on those pathways, connecting with each of them, are 7 high impact actions. These actions, again, need to take place across all 3 of those pathways. And here's what they are. We believe that if, and we've modeled this, it's not just that we believe it, we've basically seen that if we are able to implement these 7 high impact actions, healthcare could reduce its emissions by 44.8 gigatons over 36 years. That is equivalent to the entire world's greenhouse gas emissions in 2017. And so here's what these actions are. First of all, power health with 100% clean, renewable electricity. And so that needs to happen in healthcare on site, pathway 1, across the supply chain, pathway 2, and in the broader society in terms of the energy that's generated, that's purchased by healthcare and used by healthcare in the broader society. Action 2 is to invest in zero emissions buildings and infrastructure. 3 is to transition to zero emissions sustainable travel and transport. And that also means greater public transport and active transport. So we don't wind up with that slide that we just saw of the same traffic jam with zero emissions vehicles and unhealthy people sitting in the cars, right? We need to provide healthy, sustainably grown food and support climate resilient agriculture through the demand that healthcare provides for when it purchases food and serves food to its patients. We need to incentivize and produce low carbon pharmaceuticals. We need to implement circular healthcare and sustainable healthcare waste management so that basically we're applying principles of the circular economy to healthcare. And we need to establish greater health system effectiveness and efficiency. In many countries, healthcare is so inefficient that it is wasting a tremendous amount of resources. And so we've attached, if you look at the study and the roadmap, you'll see we've attached the basic size of reduction to each of these that we've been able to model. But there's a lot we've not been able to model. And so that, again, is this uncharted territory. And so in addition to deepening the decarbonization in those 7 areas beyond what we've been able to actually estimate, there's a series of ways that we can begin to reinvent healthcare, from merging the principles of sustainability with the approach to universal health coverage, so that universal health coverage becomes green and they become one and the same. Moving toward greater telehealth is something that we weren't able to measure or model in this, but is a key part of the transformation of healthcare to provide better access to care for many people, and at the same time to reduce carbon emissions. Integrating sustainability and zero emissions and resilience in emergency response and pandemic preparedness in the future. Looking at disease prevention as climate prevention. So part of what the roadmap did is it began to model global tobacco cessation goals and the carbon reduction that can be achieved by the reduced hospitalization from tobacco, from obesity, from air pollution, and from other key areas that are global health goals. Green health financing and health sector-based residual management solutions. And that last one is a completely unexplored area, but I saw you had a panel on offsets. And the idea here is, which is a very controversial thing, but rather than having nature-based solutions, that there may be some health sector-based solutions where investments in health could actually help reduce emissions as well. So there's a lot to explore, a lot to reimagine as we move forward to decarbonizing healthcare. And finally, the roadmap has a set of recommendations for national governments, for the UN and other international organizations, for the private sector and for civil society. And I want to just sort of talk about for a minute, as the last part of this, the fact that this is not just an academic exercise, that again, there's a lot of momentum happening now at the local level, in many countries, and at the global level. And we're seeing the health sector really, it's come late to the party. Rees was talking about how, the world's waking up to climate change. It's a little bit late to be asking for urgent action. And, I think the health sector were guilty more than anyone of not being on this for the last 20 years. But it's starting to happen now. And so let me give you a couple of examples. One is that we are in partnership with the UK COP presidency, the WHO, and the UNFCCC to seek commitments from national governments in the lead up to the COP for greater resilience and greater decarbonization. And so we really hope that the government of New Zealand, the national government, will join this effort to make commitments to resilience and decarbonization as part of a multi-country effort to move toward climate resilient, sustainable, and low carbon health systems. Second, we're also working with UNFCCC as the healthcare partner of Race to Zero. And we just launched this last month. 40 healthcare institutions representing the interests of more than 3,000 hospitals and health centers in 18 countries joined the first cohort of Race to Zero. And we had a couple from Australia. We're still waiting for our first Race to Zero participants from New Zealand. So we would love to see any non-state actor, that means any health institution that is not the national government, can join Race to Zero. So that means provincial government systems, local government systems, private systems, you can all join Race to Zero. And it's a great way to sort of set a goal and begin to commit to that healthcare decarbonization. And we're seeing leadership from every continent in the world participating in Race to Zero. Last couple of slides here. Finally, on resilience, WHO has now come up with a framework for developing countries in particular to build climate resilient and environmentally sustainable healthcare facilities. And the World Bank is about to come out with a report around taking advantage of that COVID moment and moving toward climate smart healthcare. So we helped write both of these, but they're both really important that we're seeing mainstream global institutions take on this agenda and this approach, which is really important. That top-down piece is important. The bottom-up piece is also important. And we will next month be releasing a carbon footprint calculation tool for healthcare facilities so that those of you who are working in facilities can actually use this tool to measure your footprint and begin to identify the actions that you can take on the ground to make this change. And I just want to kind of close here by circling back around to what Reeves was talking about, which is that all of this has to connect back to the community. All of this has to be about restoring relationships. It has to be about restorative justice and climate justice. And so it is our communities that are most impacted by the pollution that causes climate change. It is the most marginalized communities and the poorest communities all around the world, whether they're indigenous communities or communities of color, or some of the poorest nations on the planet that are the most impacted by climate change itself. And we need to start identifying ways that our hospitals and health systems can actually support communities in that restorative relationship approach and not just be gleaming towers of disease treatment, but rather health prevention systems. And so, you know, one last example for you as a note of inspiration is that here in the United States, we are working in a collaborative with local communities, with 2 major health systems and several schools to create a food processing center that sources locally produced, sustainably produced produce, turns it into meals that are then distributed in hospitals and schools. It employs people in low-income communities to do the work, and it's going to be cooperatively and community-owned. And so this is a way, and it came from health system investment. So this is a way that we can begin to build some of those restorative relationships between these big institutions in our society and the communities that have been most impacted. So again, I would just like to close by saying that, you know, as I mentioned at the outset, the roadmap that we produced is designed to be a navigational tool for transformational systems change. It's supposed to create this big picture. Is a little picture sitting within Reeves' big picture. It underscores that it's imperative for the health sector to seize the moment and provide the climate leadership the world so desperately needs. And while there is no vaccine for the climate crisis, prevention and preparedness, 2 fundamental healthcare principles, are what can help save the day and deliver healthy people on a healthy planet. So thank you so much. It's been an honor to speak with you today.